Hey folks, good Monday morning. Glad you're waking up with us. Sean Dowling here.
Hi there, I'm Danielle Volmar.
Hey everybody, I'm Oliver Thomas.
Good morning. I'm Ashley Johnson with Eye Opener, here with Dr. Felicia Stoler. Dr. Stoler's here to discuss some of the weird reactions your body can have to exercise.
Yes.
So what are these symptoms?
Well, first of all, a lot of times people complain about joint pain, especially knees and ankles, when we haven't used our muscles in our joints very much. That's the first area that seems to go out, and especially as we age, that becomes a bit of a problem for many people because we're pounding on them. So what happens is that there are some solutions. So first of all, we're going to talk about having some anti-inflammatory foods that we can eat. So apples, salmon, beans are really great. But some other things you could think about are considering supplementation. So for example, we've heard a lot, maybe people have heard a lot about glucosamine chondroitin. What really is great is that there's a product called BioCell collagen, which is a multi-patented product, which is found, you can get it in lots of forms. You can get it in pills, you can get it in beverages, you can get it really easily at something like a vitamin shop, and it's highly absorbable. And what's nice about it, it goes right into the joints, and it's also great for skin. So if you think about where we have collagen in our body, it's in our gums, it's in our hair, it's in our nails, it's in our joints. So we really need it. It's part of our connective tissue. Another thing that people sometimes complain about, especially now, allergies, right? They go outside, they're running, they're walking, they're allergic to things that are outside. So, you know, definitely want to consider taking some type of an antihistamine or some type of allergy medication if you are indeed allergic to the great outdoors, because we don't want to stop people from doing the good thing when it comes to exercise.
Definitely.
And then there's also sometimes people like to drink orange juice or coffee in the morning. They complain that it gives them a little indigestion and they get heartburn. So again, you want to take an antacid before you go out and exercise. So you can have your beverage or you can have whatever it is that you want to have, but if it's going to give you a little bit of heartburn, I say don't burn through it. You want to actually, you know, take an antacid. And then another big problem is gas. You know, you think about yoga. Nobody wants to be in downward dog and let one out, right? So, you know, some foods that tend to be more prone towards gas are cruciferous vegetables like broccoli, or something like dried fruit can be a culprit. So it's a good food, and it also can be a culprit. And the same thing, some people find dairy products to be highly gaseous as well.
So all of these reactions can come from just exercising. Well, is it common?
Well, it's what happens with your body, with foods in your body while you're exercising, or sometimes the environment. So for example, with joint pain, a lot of times when people are overweight, because they have all this extra weight that they're carrying around, it does create more problems. You ask any sports medicine doctor and they'll tell you the #1 reason why people come in is because of joint pain. So there are products out there that you can take to help minimize that, and certainly to help us to age more gracefully.
All right, well, Dr. Stoler, thank you for joining us today.
My pleasure.
Eye Opener will be right back, so stay tuned.